Welcome to this session organized by the Partnership for European Research on Occupational Health and Safety. PEROSH is a network of 14 institutes across 13 countries in the European Union that deals with research issues on occupational safety and health, and it's represented by the National Institute in the relevant countries. For this session, some of the speakers, some of the institutes have provided their insight to activities that have been carried out during the COVID-19 pandemic at national level and by their institute. So in this session, we will hear presentations from Laurent, who is the chairman of the PEROSH Scientific Steering Group, and he is based at the INRS, the National Institute in France. And then we will have presentation by Dr. Anita Tisch, who is based in BAuA in Germany, and she will talk about the infection control measures and occupational safety and health in Germany, in German companies during the COVID-19 crisis. Then we will hear a presentation from Dr. Rebeca Martín Andrés. She is based in INSST in Spain, and she will talk about working in times of COVID-19 and in particular about psychosocial risks and emotional impact on health center staff. And then we will hear from Noortje Wiezer. She is based in TNO in the Netherlands, and she will let us know about working from home during the COVID-19 pandemic in the Netherlands. And lastly, we will hear from Fabio Boccuni. He is a researcher at the INAIL in Italy, and he will present a risk analysis of COVID-19 at workplaces and practical approaches by activity sectors in Italy. So I am pleased now to start with this session, and I give the floor to Laurent to give his presentation. Louis, please, it's your turn.
Thank you, Diana. I shall summarize what has been said during the COVID session at the fourth PEROSH Research Conference. So first of all, I have no conflict of interest to disclose. So as said, Diana, PEROSH is a network of 14 European occupational safety and health institutes, and every 2 years, the network organizes a conference, and the last one took place in Madrid in September. And one of the topics of the conference was pandemic and post-pandemic challenge. We have 70 talks from 11 institutes organized around various subtopics. I just want to stress the point that this does not cover the whole activity of PEROSH about COVID, but this gives already a good overview. So you have here the list of the contributors to this work, and in red, the 4 people invited to present their work into more detail at the present session. So let's move on to the first topic. The first topic was about the determination of risk factors for contamination at the workplace. So the aim of this work was to optimize prevention measures in company or at national level, and sometimes also to get national policies. We shall have an example later. 2 talks were dedicated to job exposure matrix for COVID. We had 2 examples by INAIL and TNO. And the first step is to determine risk factor and to attribute scores to each activity sectors or job title. So people have first to describe the economic activity to split it into sector activity, to define the list of risk factors, depending on the study, we had 3 or 8 dimensions, depending on the details to describe these risk factors. And after that, the work consisted in scoring the activity sectors, using in one case experts, and in the other one database. In both cases, the method has been assessed. In one case, by comparing the risk derived from the matrix with the claim ratio, on the other one, comparing the opinion of different experts to see if it was coherent. We had also a third talk on a different topic. It was a method to analyze outbreaks at the workplace in UK. 9 companies agreed to be part of the study, and in all these cases, various aspects of the outbreak have been investigated. The full protocol in a given company lasts 6 weeks. The work consisted in detailing the outbreak history in the company, to have a good idea of what was the work environment, surface contamination, parameters for the ventilation, and also, of course, many data about the participants, their activity from questionnaire, and also different biological tests. This work is still in progress, but we have just preliminary result about the role of social distancing, the ventilation, and measurement and surface contamination. So this was the first topic of the conference. The second topic was about psychosocial risk at the workplace, and we had 2 talks. Both talks were related to the care sector for healthcare in Spain and nursing home in France. And this talk presented a lot of similarities, but also difference, because they were not exactly the same institution and the same method. The method used in this work was a review of literature and interviews or questionnaires. And in both cases, it has been found that psychosocial risk factor increased during the pandemic, and there is a list of the risk factor: pace of work, cognitive and emotional demands, world conflict, the fear due to the high-risk environment, isolation, lack of acknowledgement, perceived lack of training. And in both cases, also the health effects were investigated with a list of symptoms. It was on the Spanish side. And in the French study, a global score of perceived health has been derived from a questionnaire and correlated to a different factor. And the correlation between the perceived health and all these risks was depending on professions, not the same for nurses and managers, for instance. And this was the aim of this study. In both cases, prevention measures have been derived. In one case, the study stressed the importance of social support and increasing resilience of staff. On the other study, what was stressed was the importance of training and the information of changing protocol and the role of acknowledgements also. Third topic, the prevention at workplace. We had 5 talks. 3 were related to the implementation of prevention measure at workplace. So the method was more or less the same, with regular survey during the pandemic and the analysis of implementation of various prevention measures, divided in category: personal prevention measure, organizational measure, telework, psychosocial risk. On the effect of the size of the company, the sector, goods or services, the educational level of staff, all these factors have investigated, and they had, of course, an effect on the implementation of prevention measure, but also the type of measure. Several times it has been stressed also that the COVID had the effect to increase the awareness of PEROSH in company, and this effect is likely to last later after the pandemic. The Finnish Institute discussed its action to implement prevention measures in companies. So the action to guide company about biological risk, mental well-being, cleaning, etc. And they also advise workplace to establish preparedness teams playing an important role to implement prevention measures locally. And they also stress the importance of communication inside company about the pandemic risk and risk measurement. It was really also a key factor. A different study was by IFA. It was an attempt to derive the effectiveness of regularity measure. The idea was to correlate incidence rate, intensive care unit case, R value for factor about the pandemic, severity of the pandemic, and the prevention measure. In both cases, we had time series, and the idea was to correlate to see which measure had an effect on the pandemic. And it was just in a part of Germany for a limited time, but they found that the most important factor seemed to be the contact prohibitions. So the last topic was the effect of telework with 6 talks. We have a combination of 2 methods, literature review, even papers before the pandemic, because telework is not a new thing, or in some case, recent literature review, I mean papers published after the beginning of the pandemic, and a lot of longitudinal survey also, often with the first measurement before the pandemic as a reference point. There is a good convergence between this study to say that positive effect of telework, more time for family, more flexibility. People feel they are more efficient at some tasks, and they have also fewer problems with some colleagues. And there are, of course, negative effects also, like a fuzzy boundary between work and family life, poor ergonomic conditions, sedentary behavior, etc., and also increased job boredom, especially for young workers after some time. And these effects are modulated by determinants. The fact that the telework is compulsory, the dose of homework, it's not the same thing if you have 5 days a week or 1 day a week. The effect seems to follow a U-curve. The work situation, the fact that you need or not colleague to perform your work. And interestingly, one talk discussed the question of gender. It seems that women have larger responsibility at home, but they're more positive than men, while men worry about missing out on career opportunities when they are at home. We had one talk about online training course for employees working at home. The idea was to train employees, to tell them how to work at home. It was roughly a training course about how to self-organize yourself at home. And this training has been assessed with a randomized controlled trial, and a clear positive effect was found. And it seems that the improvement comes mainly from the fact that people learn how to regulate their working time at home. So to summarize, we had many talks on COVID, and to summarize, we have learned a lot of things how to prepare for the future, about infectious risk assessment, better understanding the factors ruling the efficiency of prevention measures in company, better knowledge of psychosocial risk in some sectors. And also, several authors pointed out the fact that the pandemic increased the company's awareness of PEROSH. We have learned also a lot of things about the new work organization enabled by information technology, such as telework and more generally remote collaboration. And the pandemic provides opportunities for a better understanding of risk related to telework. However, some results cannot be extrapolated because this was done in extreme situations with compulsory telework. And all the pandemic will clearly likely impact future work organization. And some study provided light to prepare for the future, like training for telework, training also for use of tools for remote collaboration. And as it often happens during a PEROSH meeting, we observe at the same time a convergence of views from different actors, and also the coexistence of various approaches, and sometimes different due to the different culture. So this accounts for the richness of such a research network. Thank you.
Thank you, Luis, for your very overarching presentation that really showed the added value of a network like PEROSH is. Now I am happy to give the floor to Anita Tisch. She comes from the Federal Institute for Occupational Safety and Health in Germany, BAuA, and she will talk about infection control measures on occupational safety and health in Germany during the COVID-19 crisis. Anita, the floor is for you. Thank you.
Thank you very much. I hope my microphone is on now. Yes, it is. Yeah, thank you very much for having me. Thank you very much for the invitation. And also thank you, Luis, for the summary of our sessions in Madrid, which was very enlightening to again see all the European colleagues. And I think we had too less discussion during the last year of the crisis, and I hope that we will see this as a starting point to have again more European discussions and share our opinions and our research results in the future. Um, I'm here to talk about one specific topic. The BAuA was involved in many topics during the pandemic, but we also focused on monitoring. We tried to have like a very stable picture on how establishments in Germany implement occupational safety and health during the COVID-19 crisis. And I want to give you some results for today. First of all, I have no conflicts of interest to disclose because the study was completely funded by our Federal Institute themselves. Let me start to give you a few overview about OSH and OSH regulation in Germany during the COVID-19 crisis. In January 2020, we had the first official occurrence of SARS-CoV-2 in Germany, and shortly after that, the WHO declared SARS-CoV as a pandemic. Already in April, our Federal Ministry for Labor and Social Affairs implemented the SARS-CoV-2 Occupational Health and Safety Standard, which kind of gave some guidelines to the establishment how to implement OSH infection control in the pandemic. However, it was very low, it was on a very low level, and so the social partners together developed the SARS-CoV-2 Occupational Health and Safety Regulation, which was implemented in August 2020 and updated during the pandemic a few times. In addition, in January 2021, we had the SARS-CoV-2 Occupational Health and Safety Audience, which was even stricter in some regulations, like, for example, the mandatory of telework. When we sum up the COVID-19 OSH regulations in Germany, we can see that we had a rather rapid implementation of the regulation. It was at least more fast than other implementations of regulations in OSH before COVID appeared. And we also see that the specification of these guidelines were implemented very fast. And also we see that all establishment really worked hard and fast on the implementation of these methods, and even before that of ad hoc methods to ensure occupational safety and health. What did we do? We did an establishment survey, establishments in the COVID-19 crisis, and we did that in cooperation with the Institute for Labor Market Research in Germany. The Institute for Labor Market Research interviews about 1,500 to 2,000 establishments every 3 to 4 weeks since the beginning of the crisis. So this is a very high amount. And all companies take part in this survey up to 6 times, and then they change to different companies. The BAuA was involved in 4 survey rounds of this establishment survey. And I want to talk about the results we gained from 2 rounds, from the round in August, September 2020, which focused on occupational safety and health, and also about infection control measures implemented at an early stage of the pandemic. And second, I want to give some results from the 4th round we were involved, which again focused on OSH, but not only during the crisis. We also asked these establishment how they plan to deal with OSH in the future, and we asked whether or not some things might have changed. So when we look at the timeline again, we have 2 survey rounds we focus on. The first one right at the beginning of the crisis in Germany, and the second one a year later in August 2021. And for this presentation, I asked these 3 questions. First of all, I asked whether or not we can observe an increase in attention and importance for OSH through the crisis. and whether or not this applies equally to all companies, or we see differences in specific characteristics of companies. And also, and this is of course something very new, I want to discuss how stable these changes might be in the future. Well, first, some findings from August 2020. We asked who was involved in the implementation of OSH and infection control measures during the COVID-19 pandemic. And we see at a very early point in the pandemic, almost 80% of all enterprises in Germany said yes, they made special measures to ensure OSH and to ensure infection control in their departments. And we also see that almost every of this company, the management was involved. About 98% agreed that they said yes, it was something, it was a matter of the bosses, like the management was involved in OSH. This is kind of new because before the crisis, OSH was often held responsible by OSH professionals, whether or not they were internal or external. Then we asked a long list of different measures implemented to ensure infection control and also OSH during the crisis, and we kind of sorted them and weighted them. And we can see, and this is the first row here, that about the majority, about 40%, in our opinion, implemented sufficient organizational or personal measures. So measures on the organizational level, such as a change of working time or telework, or personal measures such as wearing a medical masks or avoiding contacts. Another third also implemented sufficient organizational and personal methods, and only about 15% of all establishments implemented also measures which address psychosocial risk during the pandemic. However, when we look at different company sizes, we see big differences here. We see that large enterprises are more aware of psychosocial risks. About over 40% of the large companies address also measures to address psychosocial risks during the crisis, such as a high intense work or a high risk of infection. Also, large companies are more likely to implement a sufficient number of organizational and personal methods. And on the other hand, micro enterprises and small enterprises often only implement one type of measure. This might be sufficient enough because when you have only a small enterprise, maybe only one or two measures are enough to ensure occupational health and infection control. But also, we think it is alarming that they are not really aware of addressing also other measures and also addressing measures addressing psychosocial risks. So, we again asked about 1 year later a list of different infection control measures. And again, what you can see here, are the dark blue bars, that personal methods such as the provision of medical masks or avoid presentism when you have symptoms, typical COVID-19 symptoms, are still very broad in all companies. And organizational measures such as expansion of telework or the replacement of personal meetings are only sufficient for some companies. And we also, oh, sorry, there's one missing. Okay. The bars in the second row implement the question whether or not these measures are relevant also in the future after the pandemic is over. And what we can see here, that especially these organizational changes, the changes, for example, that they want to expand telework or they want to replace personal meetings by virtual meetings, is very likely that many establishments hold on to these changes. So we expect there an organizational change in the way we work, which also helps with some implications for OSH organizations in these organizations. Yeah, furthermore, we asked about the future relevance of occupational safety and health. And again, the dark blue bars first, we asked whether or not OSH will be important for management decisions. And what we can see here is that across all establishment size, about 2/3 of all companies said, yes, we are aware that OSH is important, that the health of our employees is important, and we want to consider OSH more in management decisions in the future. That's at least what they say. We will see what they will do. We also asked about digitalization of OSH, and we asked whether or not they plan to invest in digital tools to implement OSH in the future. And what we can see here is a clear difference between a small and a large enterprises. Large enterprises, a great majority says yes, we want to invest in digital tools to ensure OSH in the future, while small and or medium-sized companies are less likely to invest in digital tools. So this kind of gives us a hint where we might have to work on how to support also small and medium-sized companies to ensure also digital tools. So when I summarize what we found, we can see an increasing importance and attention of OSH during the SARS-CoV-2 crisis, and there is a chance that OSH becomes more important also in the future, because the management of almost all companies in Germany became aware of the importance of OSH. However, we see persistent differences with regard to, and especially with regard to establishment size. We see that large companies have a good organization of OSH already, what they could rely on during the crisis, but small companies are still kind of like behind, and they need more support in enabling OSH, and also digitalization of OSH. And third, we see a change of sustained awareness and also of organizational as well as technological change in OSH practices, again, with differences in different companies. I want to thank you very much that I could show my results today. And I also want to thank you, my team at the BAuA and the IAB, who made this work, brought this work into a lot of publications already, which can be found at our BAuA website.
Thank you, Anita, for this presentation. It was really interesting to see how much work you have been performing and doing during the COVID-19 crisis to understand how the issues and the health emergency has been faced and also managed in so many establishments in Germany, and taking into account so many differences. So the study is really interesting, and thank you for sharing this with us. Now I would like to give the floor to Rebeca Martín. She is a researcher at the INSST, and she will talk about the psychosocial impact on health sector and health workers during the COVID-19 crisis. So Rebeca, the floor is for you now. Thank you.
Okay, thank you, Diana, for the introduction. And thank you for the invitation to this special session too. Today I'm here as a coordinator of the project PsyCovid, Scenarios of Action and Preventive Tools Against the Psychosocial Risk of Working with COVID-19 patients in the healthcare setting. It was carried out during the first months of the pandemic. First of all, I declare that I have no conflict of interest. And before I start my presentation, I would like to introduce you to Victor Aparicio. He's a very active person on social networks, and during the early stages of the pandemic, he was interviewed by numerous media. On March 31, 2022, he posted a tweet in which he says, "I am an ICU nurse. 1 year separate these two images. I think the external change is evident. You can't imagine the inside." In this context, we started our study with several objectives. On the one hand, to confirm the hypothesis that healthcare professionals had been exposed to psychosocial risk factors during the COVID-19 crisis, and that exposure to these risk factors would lead to health damage. And on the other hand, to develop effective preventive intervention measures. This project was carried out during the first and second waves of COVID-19, and the population targeted includes professionals who were in contact with COVID-19 patients on the front line, not only healthcare workers such as doctors and nurses, but also non-healthcare professionals like cleaning staff, nursing aides, etc., in public hospitals and primary care centers. Within the healthcare sectors, there are various groups, but as shown in the slide, more than 80% are made of doctors, nurses, and nursing assistants. In this sector, we found a high feminization of staff, around 60% for healthcare workers and 99% in the case of cleaning services, as well as a rate of short-term contracts above 40%. We studied the reality by a systemic analysis, which allows us to understand the key elements in the prevention of psychosocial risk. We followed the CDS methodology developed by the research department of our institute, which allows applying system thinking to the project development by means of creative and innovative techniques. We rely on three methodological tools. Firstly, a statistical analysis of the 2019 National Labor Force Survey. This analysis allowed us to characterize the groups under study in terms of socio-demographic unemployment variables. In addition, a literature review was conducted to explore psychosocial risk factors and their effects on healthcare workers exposed to traumatic events. The scientific literature resulting from several searches in various databases was analyzed: PubMed, Scopus, and Cochrane Library Plus. A total of 1,433 scientific articles were obtained, of which 52 met the inclusion criteria. Finally, 41 in-depth interviews were conducted with various actors involved in the object of study. An interview script was drawn up for each of the groups, like health center professionals, prevention services staff, etc. From the interviews, information was obtained from 5 sources, as you can see in the slide: functioning of prevention services, impact of the crisis, psychological support received, and the future outlook about its situation. All the information obtained was captured in a systemic diagram that provides a clear visual representation of the reality. This allows us to identify the key points for the effectiveness of the preventive measures. First, that they were easy to implement and low cost, and second, measures that were accepted by the healthcare staff. In terms of risk factors, the results confirm, in line with previous research, that the working conditions in healthcare facilities during the pandemic have led to intense and prolonged exposure to various psychosocial risk factors. Firstly, the massive demand for healthcare resulting from the pandemic has led to an intensification of working time, burden, and pace of work. In addition, staff in healthcare centers has experienced uncertainty due to the lack of knowledge about the disease and the need to adapt quickly to new working protocols that lead to increased cognitive demands. On the other hand, health professionals have been forced to make critical decisions due to the limited resources available at the beginning of the pandemic, which result in role conflicts. Moreover, the contact limitations with sick people and their families, as well as the proximity to their pain and suffering, led to an increase in emotional demands. And in addition, we can't forget that the above situation took place in a high-risk work environment, too, in a context in many cases of isolation of the healthcare professionals who have lived in fear of infecting their friends and family. Some have even had to cope with the loss of family members, friends, and even colleges, which adds an extra emotional burden to all of this. This exposure to risk factors led to a range of health effects. For example, people interviewed reported sleep disturbances, muscular discomfort due to the accumulated tension, and feelings of hopelessness, sadness, and fear. In this respect, scientific literature indicates that the main disease resulting from harsh working conditions in circumstances such as the current health crisis are depressive and anxiety disorders, burnout, and post-traumatic stress disorder. In addition, our analysis allowed us to identify the most vulnerable group at risk: women, nurses, or low-qualified professionals aged between 20 and 30 years with less than 5 years of work experience and no previous training in crisis intervention. If we combine the results of the literature review with statistical analysis, we see that the high-risk group is widely represented within the working population of healthcare facilities in our country, mainly for two reasons. First, in this sector, there is a high number of nurses, nursing assistants, and cleaning staff, with a very high percentage of these groups made up of women. And second, the need to hire additional staff in health centers due to the emergency has led to the recruitment of a large number of trainees or recent graduates with little or no professional experience. In terms of preventive measures, the results show two types of intervention particularly effective during a health crisis. Those based on social support, one of the main mediating factors between psychosocial risk and their negative effects on workers' health, and intervention aimed to increasing resilience, which have proved to be effective in mitigating the effects of exposure to psychosocial risk factors that could not be avoided. In addition, the information obtained from the interviews revealed that in order to develop effective preventive tools in the pandemic context, these had to be adapted to the workers' needs and characteristics. 4 profiles of interest were identified in this respect, determined by the combination of 2 factors: the degree of acceptance of psychological help and the time available to receive it. An archetype was developed for each profile, including basic information of their personal and professional characteristics, expectations, needs, fears, etc. And these informations allowed for the development of preventive measures adapted to each profile. As a result of the project, the guide Working in COVID-19 Times, Best Psychosocial Intervention Practices in Health Centers was published in January 2021 and is available on the INSST website. The document presents the main results of the project, proposes preventive measures too, and offers practical tools for prevention services. The guide is being used for the implementation of preventive measures in some health centers in Spain. This is the case, for example, of the Galician Health Service, which has developed an intervention plan on psychosocial risk based on the guide, which is being very well received by all the agents involved. In summary of the above, we can conclude that there is evidence that frontline work with COVID patients in healthcare setting has led to exposure to psychosocial risk. There is also evidence linking this risk exposure to health damages, which puts healthcare workers at risk. There are effective preventive intervention strategies for such situations, namely those based on building resilience and social support. Establishing formal peer support networks integrated into the organization of healthcare facilities could be an effective resource not only for providing emotional support to those in need, but also for identifying those in need of help and facilitating their acceptance, their help acceptance. It is necessary that these interventions are integrated into the health center's general organization and adapted to the targeted staff, so that they overcome the barriers faced by each group. But beyond the health crisis, the study has shown that the attention paid to psychosocial risk in the health sector is currently insufficient, and further research is needed to investigate the causes and develop possible situations. On the other hand, the study has a number of limitations to be taken in account. As mentioned above, it focuses on first and second COVID-19 waves, so the results may not be representative of the situation of the health facility staff after subsequent pandemic waves. Interviews were carried out exclusively with healthcare personnel from centers in Madrid, which may imply a bias. And in addition, the literature search was mainly focused on post-traumatic stress disorder, as this was the most likely outcome based on our initial hypothesis. However, the spread of the over time is leading to broader effects such as anxiety disorder and burnout. Finally, we must focus on challenges faced by the health sector once we overcome the crisis situation. The ecological situation is stabilizing thanks to mass vaccination of the population. This means that the health centers are gradually regaining their pre-pandemic stability. It is therefore necessary at this time to assess the damage magnitude in order to identify groups that are more at risk and prioritize preventive interventions according to identified needs. And as we know, mental health surveillance is always of vital importance, especially in professions exposed to emotional distress, such as those in the health sector. This surveillance is even more important now that we are aware of the psychosocial risk faced in health centers during the pandemic. Health surveillance actions and technical actions for the prevention of psychosocial risk must therefore be coordinated in order to increase their effectiveness. In Spain, during the months of confinement, we went out to the windows and terraces of our homes at 8 p.m. to applaud the professionals in the health centers. It was a show of gratitude and support for these people who were fighting the virus face to face. Now it's time to turn applause into action. It's time to value their work and to take care of their mental health. Thank you very much.
Thank you, Rebecca, for this presentation. It was really interesting, and I really appreciate the sharpness with which you analyze also the limits of your study and what can be improved in the study, taking into account also what we have faced in the recent past. So after the second wave, we've had the third and the fourth, and probably the impact on the psychological health of the health workers has been even worse and needs to be considered for future action. So thank you for your presentation. Now, I would like to give the floor to Noortje from TNO, and she will present the studies that have been conducted at PEROSH Institute by her group on working from home during the pandemic. So Noortje, please, the floor is for you.
Yeah, thank you. Just have to. Thank you, Diana, and thank you for organizing, you and Louise, for organizing this session and for the invitation. And I heard the presentations before in Madrid, but now that I hear them again, I really am enthusiastic about the PEROSH group and working together on these themes. So today I want to present to you the results of a study into working from home in the Netherlands during the pandemic. And the names on this slide are the names of the people in the research group. And for me too goes that I have no conflicts of interests to disclose to you. Well, the COVID pandemic in the past 2 years changed a lot in work and working conditions all over Europe, but also in the Netherlands. And for TNO, it's a very important task to investigate whether these changes also affect the health and well-being of workers, and to advise employers, employees, and the government, the Ministry of Social Affairs, on these effects. And to this end, various studies have been set up. TNO has a large monitoring program, and every year we survey more than 60,000 employees in the Netherlands, a representative group of 60,000, the National Working Condition, Netherlands Working Condition Survey. And during the pandemic, we reapproached a group of 10,000 workers that filled out the questionnaire in 2019, so before the pandemic, and we asked them to fill out additional questionnaires during the pandemic. So we asked them to fill out a questionnaire in June 2020, in November 2020, in March 21, and we've just sent out a questionnaire in November 2021. And by comparing the answers that they gave on the additional questionnaires with the answers that they gave on the baseline questionnaire before the pandemic, we can see what the effects are of the first wave, the second wave, and the third wave of the COVID crisis and the measures taken by the government on work and working conditions, but also on health and well-being of workers. Well, additionally, we also gathered information on a large group of experts from different fields to enrich our data, and we did some interviews with employers to ask them about the measures that they took during the pandemic and their plans for after the pandemic. And finally, we also we monitored a group of 900 workers very closely. We monitored them with a daily diary study, so daily measurements with an app. And this was not a representative group of workers in the Netherlands, but because we looked into their situation very closely and on a daily basis, we had a lot of information on the effect of the first wave on health and well-being of the workers, but also on their productivity and their creativity. So today I will mainly present the results of the first study, and I will focus on people that worked from home. Well, who were those people that worked from home? Well, despite the urgent request of the government in the Netherlands to work from home as much as possible, half of the employees in the Netherlands worked on location exclusively and didn't work from home. And the main reason for that was the type of work they do, because when you work in healthcare or in industry, it's not possible for you to work at home. But a small part could work at home but didn't want to or wasn't allowed to by their employer. And from the people that worked from home, almost more than 70% worked from home the entire time. So didn't combine working from home with working at the office. And when you compare the group of home workers with the average group of respondents, we see that the home workers had on average a slightly higher education level. They were slightly older than the average group. And they especially worked in sectors like the ICT, financial and business services, and public administration. Well, when we look at the effects of working from home, we see that working from home has both positive and negative effects. And the positive effects that were mentioned a lot was that working from home leads to less travel time, not standing in a traffic jam every morning. And this was very much valued by respondents. And besides that, working from home also leaves you more time for family and friends and more time to relax. And for some tasks can be done more efficiently at home. So people indicate that they were more productive while working at home. And when we look into the working conditions of home workers, we see that people that work from home sit all day and they sit behind the screen and they are looking into this small camera. So they sit very still. And they do not take enough short breaks during the day, but they also do not have enough exercise after work. So this is a serious health problem for home workers. And some of the home workers indicate that they do not have an ideal workspace at home. And this is especially the case for young people, but women indicate much more than men that they do not have the right equipment at the workplace at home. When we look at high work pressure, we see that the experience of high work pressure is not higher during the pandemic than it was before. And when we talk about high work pressure, we mean the balance between what is asked from someone and the opportunities that a worker has to meet the demands. And we see that the percentage of workers that are overpressured is not higher during the crisis than before the crisis. And we do not see a difference between people that work entirely from home or people that work partly from home and partly at the office. And in the beginning of the pandemic, we saw that workers had difficulty working for creating a good work-life balance. And one of the reasons for that was the fact that schools were closed. But during the pandemic, we see that people found a good way to balance work and private life. You can say that working from home has both a positive and a negative effect on work-life balance. On the one hand, the boundaries between home and work are blurred, and for some people it's difficult to guard these boundaries. And on the other hand, if you work from home, you have much more room and autonomy to balance work and private life. In the beginning of the pandemic, we saw that that workers indicate that they could concentrate better on tasks at home than in the noisy office surrounding. But now, in the latest waves, we see an increase that people indicate an increasing difficulty holding their attention and keeping concentration on their work. You could say that people are a little bit bored of working from home. And what is a very positive result is that home workers have fewer problems with unwanted, undesirable behavior, like bullying, for instance, both from their colleagues as from external parties, like clients or students or patients. And we had a fear in the beginning of cyberbullying, but we do not see any effect of that in our data set. And this is very important because Dutch workers experience undesired behavior more often than their European colleagues. And when we look at well-being of home workers, we see that they still have a very good health and that they didn't report in more sick than during the pandemic than they did before the pandemic. And home workers in the Netherlands are also still very satisfied with life. We did expect an increase in musculoskeletal disorder or in work-related stress complaints. And we do see that the physical complaints are increasing during the 3 waves, but still in the third wave, the percentage of people that have physical complaints is lower than they had before the pandemic. And stress-related symptoms, work-related stress symptoms were already very high before the pandemic. They stayed stable during the first 2 waves, and we see a small increase in the last measurement of work-related stress complaints. And a reason for that might be a lack of social contacts, because we see that home workers in the Netherlands, an increasing group reports to be very, very lonely. And they lack close contacts, they lack intimate relationship with others, they lack a good social, an engaged social network. And this is especially the case for young workers, but we also see that this is the case for the group of migrant workers, and especially the Western migrant workers in the Netherlands, so the expats. And this is something that we see in other research as well, that working remotely can lead to less social contacts, less bonding with the organization, and it can also decrease the more spontaneous encounters. And these spontaneous encounters can increase creativity in an organization. So this is something to keep in mind when you organize, for example, a hybrid way of working. We also asked employees, the home workers, what their preferences would be if measures are eased. And we see that of the home workers, a large group wants to stay working at home a substantial part of their working time. On average, people want to work 18 hours per week at home. And this is substantially more than they worked at home before the pandemic. And the reasons for people to want to work from home are the positive effects, so less travel time, more time for family and friends, more time to relax. And for some tasks can be done better at home than at the office. So people think they are more productive and efficient when working at home. And the group that wants to work from home is the group that has types of work that allows them to work at home a lot. And reasons why people want to go work on location is that they have a great need for collaboration with colleagues. They have a great need of social contacts. Some types of work are better done in the office or on location than at home. And a group of people indicate that keeping their work and private life in balance is easier when they work on location. So we also asked employers what their plans are for the future, and we see that many companies in the Netherlands are considering a hybrid way of working. And this corresponds with the desire of employees that already worked at home a large part of their time in the past 2 years. But the big challenge is how are we going to organize this hybrid way of working in a way that we can keep the positive aspects of working from home and that we can reduce the negative aspects of working from home. So this is my presentation. Thank you for listening.
Thank you, Noortje, for this presentation. Very interesting because highlighted also the issues and problems that measures that were meant to, of course, protect the workers from being exposed to the virus still brought into their working life different issues that need to be, however, taken into consideration to protect their good health and productivity, also working from home. So thank you very much for this interesting presentation. And now I think we can give the floor to Fabio Boccuni from INAIL in Italy. He will present the strategic framework adopted in Italy to manage the pandemic risk at the workplaces during the COVID-19 emergency. So Fabio, the floor is for you now. Thank you.
Thank you, Chair. My presentation will be focused on the risk analysis of COVID-19 in the workplaces and practical approaches by activity sector in Italy. I have no conflict of interest to disclose, and then I will introduce my presentation. The COVID-19 pandemic has spread worldwide with many public health and socioeconomic impacts. Italy was among the first Western countries to face the spread of the pandemic, and the number of hospital admissions for COVID-19 has challenged the national health system, with particular reference to the availability of intensive care units. In 2020, the progressive adoption of several containing measures by the Italian government conducted to a first lockdown period from March to May 2020. That is the period associated with the first wave, with the lines in red in my slide. This lockdown included the temporary suspension of non-essential business activities and the reduction of about 75% of workers present in workplaces, including also remote workers. Then the epidemiological trend show in sequence the effect of following containment and lifting measures in different phases. Now we are in the fourth wave in which the vaccination strategy is showing some effects. And at the date we pre-record this session, about 85% of people over 12 years old were vaccinated with 2 doses. So the work dimension, as you know, has been recognized as a key determinant in the COVID-19 emergency management. Our institute played a key role of technical advice for national governmental authorities on the matter of the pandemic and work-related impacts, in particular to identify strategies for a safe reopening of activity after the lockdown. In this framework, we developed a methodological approach for assessing the risk of SARS-CoV-2 infection in the workplace based on the combination of 3 major parameters. The first one is the proximity, that is the analysis of work process and proximity between employees, such as the intrinsic feature of work activity which cannot guarantee an adequate social distancing. The second one is the exposure, that is the potential exposure related to the type of activity. For example, the likelihood to be in contact with potential sources of infection during the work activity. The third parameter is our added value to this methodology, that is the aggregation factor, to take into account the involvement of third parties in work processes with consequent social aggregation connected to the job. Our detailed study was published on PLOS ONE on March 21. We associated a numerical value to each parameter, and the final result was the classification of each activity sector according to the National ADECO classification of economic sector, that is the equivalent of NACE classification. We obtained 4 different risk levels associated to each sector, from low to medium high to high. And then our institute collected compensation claims application also related to COVID-19 at the workplace. Well, we compared data by sector with the related risk class obtained by our methodology. And the result was that the economic sector at high or medium high risk for COVID-19 infection included about 82% of compensation claims, although they represent only 25% of those workers who remained active during the lockdown. So, starting from our general risk assessment framework by sector, each company may develop a more tailored risk prevention and protection strategy, taking into account the key factors for the management of the pandemic in the workplace. In the last 2 years, many evidences arose from literature highlighting the role of type of activity, for example, static versus dynamic activities, or the role of indoor spaces versus outdoor, and other elements to be considered in order to carry out a tailored prevention strategy for each enterprise. Looking at the proposed measures to manage the risk in the workplace, such measures may include, in general, administrative measures to manage working times and spaces, for example, remote work, shift work, space reallocations, and preventive and protective measures and the cooperation with all OSH players at company level, and then specific measures for vulnerable workers. But otherwise, some strategy for workplace may have also an impact at the community level. For example, the mitigation of mobility effects. As you probably know, there is a strict relation between the mobility of people and the virus spreading, in particular due to the commuting of workers. And furthermore, the integration in the overall health strategy of this general risk framework may be useful to prevent clusters, to trace contact, and also to test workers and vaccinate workers. So this may be an important framework to allow also an impact at community level for health. On such basis, protocols for reopening activities may be developed for each sector, including all measures in a systematic framework. In the next slide, I will report some examples. The first one is related to the transport sector. Transport, storage, and logistics sector played a fundamental role, in particular during the first phase of the pandemic, in order to guarantee the availability of essential goods to all population. And for this reason, were not suspended even during the lockdown period. Some specific categories of transport sectors, such as air transport and water and land transport, were classified in our methodology from medium low to high risk, with a medium level of aggregation. On the other hand, compensation claims data confirming a high incidence of COVID-19 cases in this sector. From literature evidences, we may highlight the main concern related to this sector and COVID-19, because we have some concern about the possibility to have a contagion by a passenger on seat adjacent, and we have also some inputs in which we can consider that the time of traveling with unindexed patients. So in this framework, our management protocols for this sector include the following measures. Such measures may be related to the shifting of rush hours with the modulation on opening and closing hours for school, offices, and shops, or encouraging alternative mobility means. We have also organizational measures in hubs and stations, and the contactless ticketing, and furthermore, we have measures for vehicles to reduce occupancy and also to improve air quality and sanitation procedures. The last one are the procedures related to the suspected case on board, and lastly, the possibility to include the EU COVID-19 Green Certificate also for passengers and workers in transportation sector. Another one example is related to the manufacturing sector, in particular related to meat and cutting plants. In 2020, a series of outbreaks occurred in meat plants in US, Canada, UK, and also in Europe and in Italy. Our a priori risk classification, this sector was estimated at medium risk. But in 2020, more than half of compensation claims in the manufacture of food sector involved meat processors and meat bakers. So we have also some evidence from literature about the factors may influence this exposure, related to the close proximity and crowded working condition of workers, cold environments that may favor the virus spreading, and also the need of workers to talk loudly over the background noise, then the environment with frequent washing down and brushing of surfaces and large quantity of droplets and aerosols. And the last one was the socio-demographic and workforce factors related to the crowded shared transports and accommodation and others. Well, for this sector, we developed a framework, and in cooperation with the National Health Institute, the regional health unit, and local prevention departments. In this framework, we included the very strict plan to prevent outbreaks in this sector. And as a consequence, we observed in the last year a reduction of cluster in this sector, also due probably to the vaccination policies. Well, this brings me to the end of my presentation. Some concluding remarks are related to the lesson learned by the precautionary approach to the management of emerging risk, which guide the development of our methodological framework. On the other hand, data from this perception indicator of national OSH surveys were the basis to estimate the model parameters of proximity and exposure, and also we include an aggregation factor to take into account the role of third parties connected to job activities. Based on new evidences from literature and COVID-19 incidence data by activity, we will be able to validate our risk classification. Protocols for COVID-19 were developed and applied in some specific sectors, and some examples I report in the previous slides. Finally, the proposed approach will contribute to rethink how work is organized, also include innovation and integration in the OSH national system. Thank you very much for your attention.
Thank you, Fabio, for your presentation and also for keeping perfectly the time that was assigned. And this, of course, this thanks goes to all the presenters. I think that we have a few minutes for a very quick, maybe take-home message from each of you. What I would like to say is that during the pandemic, we have learned a lot from each other, working together within this network. We had the opportunity, thanks to many digital tools that were made available during the pandemic, to share information, to share knowledge, to take very quick decision just by confronting ourselves through a platform that was made available by one of the institutes for quick chats and exchange of information and experiences. I am sure that what we have learned is that the management of COVID-19 has been one of the leading topics in the research agendas of all the institutes, of course, and that we have learned that many of the measures that have been put in place, like infection control and prevention measures at the workplaces, or having workers working from home whenever possible, though being measures that were meant to protect the health of workers from the COVID-19 risk, still introduce new challenges for occupational health and safety that we will probably need to take into consideration and to develop research on in the next future. I would like to invite you to a very instant and short take-home message before we close this session. So if you have any additional information or input that you would like to share, please just raise your hand and give your take-home message. Noortje, please.
Yeah. It's again very interesting to hear all the presentations, and I think we are still not done with this pandemic, unfortunately. Even if we are slightly going back to normal, it still is a very challenging time for workers, for organizations. So I think that even in the near future, we should keep working together to see how we can help employers and employees in Europe and governments.
Thank you. Anita, please.
Yes, I want to underline what Noortje said. And I think we had all the same or about the same challenges to meet during the crisis. And I think we have the same big challenges ahead. And I think it's worth to work together and to find solutions and to exchange our results to find solutions for OSH in the future.
Thank you, Anita. Fabio, I saw you raise your hand.
Yes, just a short message. My message is related to the need to improve also the involvement of all OSH players in this process for risk management, to improve also the risk analysis, in particular relating to the workplaces. Thank you.
Thank you. Rebecca, do you want to add your take-home message?
I can only say thank you for this opportunity. I think this crisis has put at the center the health, and we must focus on this to improve the attempt to security and safety at work and in others contexts. Thank you.
Okay, thank you. And maybe Louise, as the chair of our scientific steering group in the PEROSH network, you would like to give some closing remarks and to conclude this session.
Yes, okay. First, thank you very much to all speakers for this very nice and just-in-time presentation. I think this is a good example of what PEROSH members can do together. Just to put the result, we see a nice convergence on the result, but at the same time, difference. And we can learn also a lot of things from the difference. And I believe we can still work together on pandemic. There are many things to do still in the short-term future. Just for instance, to draw the lessons we have from this pandemic, to put together what we have learned for telework, for prevention measures. I think there is a big margin about things we can still achieve in a short-term future. I think we shall discuss that very soon.
Okay, so I thank you all for your participation, for giving us your views on the management of the pandemic, and for representing the views of your institute within the network. And I wish to meet you in person soon, when it will be possible after this crisis, this health crisis goes to an end. And thank you again for your participation, and bye-bye to all the attendees. Thank you.
Thank you.
Bye.
Bye.